Hi, I'm Dave Olson. I'm a co-director of the AIHS Preterm Birth and Healthy Outcomes Team, or PreHOT for short. Well, the team model allows investigators in the province of Alberta to address the real complex questions in health. Typically, an individual investigator can only look at one little piece of the pie. But when you bring investigators together, they can begin to assemble more of the pieces of the complex pie and put them together so that we get a better picture of the overall health problem and obviously how to deal with that health problem. Now, the kinds of investigators that have to come together are clearly from different disciplines. Usually, we tend to work with people who are like ourselves. So I'm a physiologist and I'll work with other physiologists. But in our team, I get to work with clinicians, obstetricians and neonatologists and epidemiologists and health economists and health outcomes people and research nurses. And together, we have a much more comprehensive look at the problem, and we also are able to add our personal expertise to solving a small piece of the pie. But we appreciate what the other disciplines bring to the team, and we value that, and we're able to integrate what we do with them. It turns out to be a lot more exciting. And the benefits are much greater as well, too. We can partner with a lot of people. For instance, partnering with these other investigators from all of the different health disciplines. That's great. We also get to partner amongst the universities, and our team has great investigators from the University of Lethbridge, from the University of Calgary, and the University of Alberta. And we get to work together, and each university has its own particular strengths, and we get to multiply those strengths. Beyond that, we get to partner with scientists around the world, and our team has people from Perth, Australia, Toronto, Ontario, and even Albert Einstein University in the Bronx, New York. So this adds a new dimension and their own unique perspectives. So that strengthens the kinds of questions we can ask, but it also allows us to sharpen our answers as well. And beyond the other types of investigators or scientists we get to partner with, we also can partner with the great organizations of the world who are interested in the level of questions that we can ask. So if I and our team are asking what are the problems of prematurity and preterm birth, well, we are now partnering with the World Health Organization and the March of Dimes in the United States and major organizations in Europe and Australia and other countries as well. So this brings a new dimension to the team as well, and that we are really at the upper echelons of asking the tough questions in health, but coming up with great solutions for the tough questions as well, too. It allows Alberta and Alberta investigators to be on the world stage, because we can approach the most important problems in health, not only to Albertans, but they translate to people around the world. So we can really approach those problems, and we can put together solid teams of investigators who are doing first-class jobs of addressing these questions. We're second to nobody in the world at this point. But I have to let government and others know that it was visionary of the former Alberta Heritage Foundation for Medical Research, the Ministry of Health and Wellness, who partnered with them at that time to bring together the funding so that they could fund the first cohort of 5 and then the second cohort of 5 teams. And that was controversial because you're putting a lot of resources into a few investigators, into a few problems. And they took a risk because they didn't know what the outcomes were going to be. So I applaud them for taking the risk. And has the risk been worth it? Oh, I certainly think so, because now teams are the model. You see more and more organizations and foundations putting money into emerging teams. So they can start with 2 or 3 investigators that can add to their complement, add to the complexity of their questions. And they're starting out with small baby steps, asking questions, and they're growing their teams. I would call our team a mature team at this point because of the depth of its questions, the quality of its investigators, the partnerships and the leveraging. The onus is on us as team leaders that we take the money that we receive from the people of Alberta and that we leverage or multiply it. And it's ingrained with every one of our investigators that what we have been given is just the start, and that we should use it to seek funding from other organizations, other partners, so that we actually can multiply it. And so, for instance, we've turned our $5 million into $13 million now, and we're not done. We're going to keep multiplying it. So I think in 2 years' time, when we reach the end of our 5 years, that I hope that number is a lot larger than it is right now. This is part of the Alberta advantage that we have. It's our onus as team leaders, but the entire team as well, to form strategic partnerships with the stakeholders and the end users of our information. And so we're not waiting until year 5 and we get all the final results. We started in year 1 to form relationships with the key ministries like Advanced Education and Technology, Alberta Health and Wellness, and the new Alberta Health Services as well. And we bring them in, we inform them, we probably meet with them at least twice a year to let them know about the outcomes of our research, and in their own way they can inform our studies. We think that the relationship we have with them is dynamic and important and iterative. So we'll do the best research we can on round 1, and we'll share with them the results, and they'll say, this is helpful, but why don't you think about doing this? So round 2 of research will be informed by what we learned from our end users and our partners and our stakeholders. So that the next round of questions is even more focused, a sharper group of questions, and we get better answers, and they're more applicable to healthcare. If we don't alter practice, policy, and programs, improve health outcomes, and make healthcare delivery more effective and efficient and cost-effective after the first 5 years, then I'll be very disappointed in what we've accomplished. But I'm quite confident we're going to accomplish all those goals. One of the important emphasis within the team grant program is that we think daily about the commercial opportunities. And I have to tell you from right off the very start that I was trained as a physiologist, as a basic scientist, and we don't think about those things every day. We think about writing papers and training students and getting our next grant application so we can keep the whole research program going. But we don't oftentimes think about what are the commercial opportunities, because we are very far removed. Some of us are. Some of our team members are right in the midst of it if they're at a point of care, if they're clinicians. But all scientists need to be tutored in commercialization opportunities. So again, I believe that the management of our teams, and we think that there has to be a superstructure to our teams, and Alberta Innovates Health Solutions has been very proactive in this. And they've asked the industry liaison offices at each of the representative universities to come and talk to us. So we are consciously now beginning to write out reports of invention. Whether or not these are truly interesting in terms of commercialization, the people at Tech Edmonton will let us know. And some of them we haven't gotten a call back on. But others, we have, they've been knocking our doors down. And in one case that I've been associated with, we've actually 4 weeks ago written and filed our first patent. And now today I got an email from one of the individuals at Tech Edmonton. He's very anxious for me to talk to lawyers to form a company to begin the next phase of commercialization. And yesterday we sent a grant off to CIHR for proof of principle to get more money to take our idea, which is still a laboratory idea done in pregnant rats, and translate it into the human arena and see if the same idea, same physiology holds true and is going to work there as well as it seems to work in animals right now. So the commercialization is very important. It's another kind of leveraging, and what we're also discovering, because the conversations are increasing within the team, we're now discovering that this might be our most effective type of knowledge translation, or KT. Because if we're excited and interested in patenting and forming companies and commercializing, it's going to reach the end user, the patient, faster than if we didn't push it, or if we let it somebody else take care of it for us. So I would say that technology commercialization is suddenly on our radar screens, and we're beginning to think about it on a daily and weekly basis. The overall value has to be better health outcomes, more efficient delivery of services, more cost effectiveness. If that isn't the end result of the investment in teams, then perhaps teams shouldn't be invested in, and we should look for other ways of doing research. But I think that that will be the overall outcome. I'm quite convinced of it. It might take a while, and there might be interesting routes from getting from point A to the end point, but I think that we will all get there, and if we're encouraged, well managed, well reinforced and supported, I think that these will happen. It clearly is on the consciousness of our team members, and as they meet together and they talk amongst each other about their individual projects, you can see the synthesis of a greater whole occurring. And this is the synergy where teams are greater than the sums of their parts. And it's happening in our team. I'm sure it's happening in the other teams as well. And I think that in the next year or two, there will be some absolutely incredible outputs from these teams. Those will be the real values if we can improve the health status of Albertans. Well, what we're discovering from our team is that we have been able to escalate the type of question that we can ask. So we're asking global questions now, and some of the techniques we're using, some of the latest techniques like genomics, require very large numbers of patients. And we have to perform prospective studies. That means we have, in our case, we have to look at women while they're pregnant and obtain blood samples and environmental data from them, so that when the baby is actually delivered, we can say, yes, we predicted that particular birth outcome. And those are very expensive studies. They cost more than the amount of money that one can imagine a team realistically getting. And so what we need to do as a community within Alberta, bringing the universities together, bringing private foundations, government, Alberta Innovates could perhaps be the broker and the leader in this, is that we need to escalate up our potential for doing world-class, world-level kind of research when these questions present themselves to us and we have the capacity to address them. So we need to bring together all the elements of the new Alberta Innovates Corporation. We have to really make use of the tech transfer of the connector service. And we have to ask our leaders within Alberta Innovates to help us move to that next level of performance. And we're not there yet, but I think that we could be with a concerted effort.